Imagine a world where type 1 diabetes is no longer a life sentence of needles, glucose monitors, and constant worry. This isn't science fiction anymore. Recent breakthroughs in regenerative medicine are bringing us closer than ever to making this dream a reality. For millions living with the daily grind of type 1 diabetes, this isn't just promising data. It's a glimmer of hope for a future free from the disease's relentless grip. But here's where it gets controversial. Could this be the beginning of the end for traditional diabetes management? And this is the part most people miss. The implications extend far beyond diabetes, potentially revolutionizing how we treat a whole host of chronic conditions. Type 1 diabetes, a chronic autoimmune disorder, occurs when the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Insulin acts like a key, unlocking cells to allow glucose, our body's primary energy source, to enter. Without it, blood sugar levels soar, leading to devastating complications affecting nearly every organ. Diagnosed primarily in children and young adults, type 1 diabetes demands constant vigilance. Frequent blood sugar checks, meticulously calculated insulin doses, and the ever-present threat of life-threatening hypoglycemia. Dangerously low blood sugar. Living with type 1 diabetes is a 24/7 job. It means fingerstick tests throughout the day, carefully planning meals and exercise around insulin injections or pump adjustments, and the constant fear of a hypoglycemic episode. Even with advancements in technology, maintaining stable blood sugar levels remains a challenge. Enter the game changer: off-the-shelf stem cell therapy. Instead of relying on scarce donor organs, scientists are now engineering stem cells in labs, coaxing them to become fully functional islet cells, the very cells destroyed in type 1 diabetes. These lab-grown cells, readily available and consistent in quality, are infused into the liver, where they take up residence and start producing insulin in response to blood sugar levels. It's like replacing a broken part in a machine, restoring the body's natural balance. A recent clinical trial by Vertex Pharmaceuticals has yielded astonishing results. Patients with severe type 1 diabetes, for whom existing treatments often fall short, received a single infusion of these lab-grown islet cells, dubbed zimislecel. Within 12 months, all participants were producing their own insulin again, and remarkably, 10 were able to stop daily insulin injections altogether. Every single patient met or exceeded strict blood sugar control targets, and none experienced severe hypoglycemia. This is a seismic shift in diabetes care, offering not just management, but the possibility of a cure. The implications are profound. This success story isn't just about diabetes. It's a proof of concept for the entire field of regenerative medicine. If we can replace lost insulin-producing cells, why not heart muscle cells for cardiac repair, retinal cells for vision restoration, or dopamine-producing neurons for Parkinson's disease? This breakthrough paves the way for a new era of medicine, where we don't just treat symptoms, but restore lost function and potentially cure chronic diseases. Of course, challenges remain. Because the transplanted cells aren't the patient's own, recipients currently need immunosuppressive drugs to prevent rejection. While initial safety data is encouraging, researchers are actively exploring ways to reduce or eliminate the need for these medications, such as gene editing and immune cloaking techniques. The road ahead is exciting. These advancements are more than just incremental steps. They represent a paradigm shift in healthcare. The future of regenerative medicine, once a distant dream, is now within reach, offering real hope for curing, not just managing, a multitude of devastating chronic conditions. The question remains, are we ready to embrace this revolutionary approach and rewrite the story of human health?